Isang makabuluhang talakayan patungkol sa ating kalusugan, kaligtasan at kagandahan. Kay Ate Doc lang yan. Mga tamang kaalaman at napapanahong usapin para sa pamilyang Pilipino. Siyempre, si Ate Doc yan. Kaya mga ka-wellness, andito na si Ate Doc, Cheryl Palad, upang bigyan tayo ng tamang kaalaman sa ating kalusugan, kaligtasan at kagandahan. Samahan si Ate Doc tuwing Biyernes, 1 p.m. Philippine Time. Dito lang yan sa V81 Radio Worldwide.
Alright, good morning mga ka-Healthwise.
Good morning, ka-Healthwise.
Ayan, and of course, Sunday na ang umaga at isa lang ang ibig sabihin niya natin, Jen.
Healthwise for Christ na,
Season 4. Ayan, kalusugan pang physical at spiritual pang pag-uusapan natin dito.
Ako po pala si Ate Jen muli.
At ako na naman po, si Kuya Ian, kapatid at kasama niyo kay Kristo. Kaya pamilya po tayo dito mga ka-Healthwise.
Oh, episode 11 na tayo, no?
Yes.
And ang topic natin is skeletal system. I think this is the last episode for this season.
Yes.
At excited na ako kasi I think next
may
week,
isa pang cooking demo tayo.
yeah, cooking demo, but the topic for this season is this is the last episode. Yeah.
Yan. And syempre, ang ating lecturer today, hindi na iba sa atin.
Na-miss namin ito.
Sobrang na-miss. Alright. But anyway, please follow us and like us on Facebook. And then, ang pangalan po is Healthwise for Christ. Dapat po nakasubscribe din po kayo sa aming YouTube channel na Healthwise ang pangalan. Ayan.
Siya nga pala yung huwag kakalimutan si Ate Doc bukas sa V81 Radio 1 p.m. Ayan. At cooking demo again for next week with Chef Lorna. May mga special guest tayo next week.
Of course. And Lifting Christ Kids tuwing Sundays and Fridays 8 a.m. Philippine time. Kanina nag-ano na po tayo. And at the same time, ito pong daily devotional natin tuwing 5 a.m. Ayan.
Lifting Christ.
Yes.
Ayan.
So hindi ko na patatagalin, Ate Jen.
Greet muna tayo.
Patagalin pa pala.
Okay, medyo na-late po kami. Meron nagkaroon ng technical difficulties. Pero still, we were able to get in and si Doc, ang ating guest. Mamaya, ipakilala namin.
Yes.
So the first 10 greeters, ayan, yung mga first 10 greeters ay makaka-receive ng 100
pesos
Gcash.
na Gcash.
Or pesos, not dollars, no? Pesos or Gcash, no? And then the first timers will receive 50 pesos. And then mamaya mga prices pa tayo sa mga question and answer.
Ate Jen, may tanong ako. Paano kung first 10 greeter din siya and first timer din siya?
Yeah, it's okay. First 10 greeters, first time. So, doble.
150 pesos.
Kasi syempre, bagong pasok sila sa
grabe naman.
Ganyan tayo mamigay.
Ang blessing ng Panginoon talaga nag-overflow. Ayan, wag na natin patagalin. Let's first call on Sweetie Bueno. Good morning. And siya yung first greeter natin for today.
Yes.
Next is si Hagen Van Santillan. Actually, Hagen Van Santillan, he is a first-timer from Bukidnon.
Yes.
Ayun. And then next greeter na naman natin is a first-timer also from Bukidnon, Jimmy Benalizo. lahat ng mga ka-healthwise natin sa Bukidnon. Magandang umaga po sa inyo and
Ang
happy,
dami mga taga-bukid nun, no?
correct, happy Father's Day sa lahat po ng ating mga fathers dyan.
Yes, Happy
Ayan.
Father's Day.
Ate Jen, akala mo dalawa lang ang first-timers. Meron pang isang pang first-timer.
So, from Bukidnon.
From Bukidnon, Marimar Bongkawil. Yan.
Marimar Bongkawil.
Happy Father's Day din sa iyong ama, Marimar. Ayan.
Mm.
And,
Akala ko from Mexico, si Marimar.
saan si Sergio? Alright, anyway. Si Bueno Honey L. Ayan. First timer rin from Valencia. Kaya,
Hindi siya first time. Ay, first timer.
yes, first timer from Valencia. Kaya happy Sunday and happy Father's Day sa inyo. And then next is nakailan na tayo sa ating first 10 greeters?
5.
Lima na. Maribeth Vidal. Ayan, from Pagudpud.
Yes.
Thank you so much, Sister Maribeth. Jing Sky. Happy Sunday. Ayan, isa na naman sa ating next. So we have 3 more top 10.
JV Quaresma.
JV
ating mga regular
Quaresma.
yan.
Ayan.
Mm.
Ludinet Casio. Ayan.
Yan.
Ay pa. Masabi nga. Nakasama pa. Hindi kayo makakalimutan. Tita Melda
Melda.
Tumaning.
Yan.
Ayan, regular natin.
Hello, Tita Melda from Ilocos.
Nakahabol po kayo. Very nice, very nice. Thank you so much, Tita Elda. And the rest po, ayan, Len Sebastian, Teresa Begonia.
Hanggang Tita Melda tumaning ang first time.
Yes, ang first den natin.
Reminder lang, once we prompt the schedule, you can already greet, no? Napaaga po yung schedule kanina, kaya nagpapasalamat kami kasi nakaabang na po talaga ang gustong makinig ng lecture natin ngayon.
Yes.
Marami pa tayong prizes mamaya.
Huwag kayong mag-alala. Si Lara Ricamares, for watching from Katanawan, lahat po ng mga taga-Katanawan, Quezon, please tell us where you're from. Teresa Begonia, yan. Tell us
Daisy
from where.
Mercado, hello.
Ayan, Sasa Reyes, Elizabeth from Silang, Cavite.
Elizabeth Pulido.
Ayan.
Ayan, si Shekaina.
Ayan, Teresita Galapon.
Degit, Teresa Galapon. We
Daisy
have-
Mercado. We
Yan,
have Venus Casbadillo.
Yes.
Ayan. And then,
Doc
Tita
Esther. Doc Esther Pagdilao. Yes, from
Ayan.
Manila.
May
Ayan.
clue. Kakosa nyo po itong next lecture. And Ate Vince Tayag from Hong Kong. Originally from
Tita
Mabalaca.
Rebecca Cusi. Hello.
Of course. Hello.
Ayan.
Ludinet Casio. Ayan.
Africa.
Africa.
Kalingasan.
Ayan.
Hello.
And Romalyn Sebastian. Joylyn Taruk.
Sana alam namin kung taga saan kayo, ano.
Uy, si Tita Feli Tagud. Ayan.
Tita Feli.
Ayan,
yes.
si Haidina from PH.
Haidina Nelmida.
Sana kung saan place po kayo galing.
Cyril.
Ayan.
Dalisay.
Cyril, yan.
Ayan.
Isang regular din natin yan. And si Elizabeth Ubongin yan, regular din po natin to.
Tapos na si Tita. And si Tita Lourdes from Batangas. Ayan.
Yes, yes,
Tita Lourdes
yes.
Tolentino.
Thank you
Michelle
so much.
Romelo. Hello.
Hello, and Angelo Alimba.
Ayan. Sister Belle.
Ay, of
Alcoriza. Hello dyan. No?
Ayan. Si Luz V. Del Rosario. First time.
Yes, first time.
First time.
Oh,
So may
yeah.
50 pesos load si Luz V. Del
Oo.
Rosario. Ayan, sama pala siya dito. Ayan, si Elizabeth. Ayan, si Feli. Ayan.
Okay.
Okay. And then, si Roxanne Lizelle. Ako, napakadami pa nito. But you know what? Thank you so much. Ay,
Sir Rocky.
Si Rocky, first time daw.
First time din. Wow. Oo nga.
First time.
Hindi Niloko mo ako, Sir Rocky. Then we have Arlan Luminate. Yan, ang
Happy
brother
Father's
ni
Day.
Brother Art.
Ayun.
Ayan.
So lahat
Shelly
daw.
Ruga. Hello.
Ayan.
Sister Cecil, watching from Korea. Cecil Park.
Ano ba? Annyeonghaseyo.
Annyeonghaseyo.
Ayan, di ba?
Yan. So
Ayan,
we have
so,
from Dasmariñas, Cavite,
thank you
Doralyn
so much.
Berber. Caloocan City, no? Si Brother Arlan.
Yes.
Gusto ko na i-greet ang mga taga-Taiwan, Japan, yung mga nakikinig, taga-US, at marami pa taga-Middle East. Marami, Dubai, saan pa ba? Marami pa. Palawan, yan. Visayas, Mindanao, Luzon, Visayas, Mindanao, ayan.
Ayan.
Okay.
O hindi na natin ito patatagalin pa, mahal na ako. Dami na nating grinit. Pero ito pong ating lecturer for this morning is a servant of God. Ayan. And is a dentist by profession. And by the grace of God, She was first place in Philippine licensure exam back in 2017. First place siya dun sa licensure exam. Wow.
Wow.
God has led her to specialize in oral and maxillofacial surgery at Adventist Medical Center, Manila on 2017 to 2019 and pursued clinical attachment at the University of Malaya in Malaysia. God has brought her to mission trips in distant islands wherein she learned to surrender her life, career, and future for the Lord's work. Aside from sharing Christ to fellow dentists and students, God has led her to different online ministries such as Adventist Medical Evangelism Network and is part of multiple projects such as the Great Controversy Project and Grandma Said Urban Center of Influence. It is her desire to know God, to make Him known in her profession and to her patients. Walang iba po kundi si Doc Alexa Eileen Tajud.
Ayan. So,
Ayan.
Sister Shalom, hello!
Ayan.
Ayan. Tita
Pasok na si...
Belinda.
Ayun.
Ayan.
Hello! Hello, Doc
Hi!
Alexa!
Doc Alexa. Tamang-tama.
Hello,
Doc.
magandang
You're a
umaga.
dentist. Magandang umaga. You're a dentist, we're gonna talk about skeletal system.
Yes.
Alam na natin ang ngipin, ang pinakamatibay yata, no?
Yes, so marami tayong madi-discover today. So actually, si Doc Elvin, he really wanted me to focus sa dental aspect daw. So alam natin na broad ang skeletal system, pero
Okay.
of course, when we realize na during the pandemic, 'di ba, ang hirap ngayon na magpa-schedule any like even the dentists have to adjust. So ang gusto namin ngayon is to promote more oral health awareness, 'di ba po?
Ayan.
So mga ka-health-wise, yun yung ating gagawin this morning.
Yeah.
Magre-review tayo ng mga basics kung paano natin mas maalagaan ang ating ngipin para, 'di ba, hindi na natin papaabutin pa sa mga masakit na ngipin, sa mga appointment na kailangan umiiyak pa yung mga bata. So gusto natin na magandang experience ng ating mga kids or mga even adults, 'di ba? Gusto natin na pag pumupunta tayo sa dentist, it's a experience na aliwalas lang, like regular checkups and the like. So thank you for inviting me here.
Yes, excited ako kasi alam mo, Doc, actually, sa study, even sa public health namin, no, ang research mostly kasi ang mga Filipinos, especially children and kids, common yung nasisira ang ngipin maaga pa lang. Kaya maraming mga pustiso na mga Pilipino. So bakit kaya? Pero sa ibang lahi, hindi, I mean, that's very common lang in the Philippines, no? Nangisisira ang mga ngipin. So nasa kinakain din yan. So i-discuss yan ni Doc mamaya. So before, gusto mo namin i-greet yung ibang mga bagong pasok, ano? We have from Thailand, si Sister Dolly, Dolly Pops, ayan, from Thailand. And Arlie Rodelas, okay. Sister Belinda Fronda from Silang. Abel Kilog from LA, California.
Wow, Abel Kilog, if you could join us sa ating camp meeting July 9 to 11, please get in touch with us.
Yes, Sister Marlene Ise from Pampanga. Ayan,
Ayun.
and we have Milagros Garcia. Ayan.
Oops.
Okay, so
Ah.
ayan na, si Doc. Okay,
Ayan,
I think
nawala.
we can share
Okay.
the screen now and Doc, you can start the lecture. Makinig po ang lahat kasi we can have question and answer. Mamimigay po kami ng mga regalo, gifts, load.
Take note, take note.
Okay. And sa mga first-timers po, magbe-message po kayo sa Healthways for Christ sa inbox namin para po malaman po namin na first time kayo and yung inyo pong mobile number. Ayan.
Okay.
Okay.
Okay, so we will share now the screen of Doc Alexa. There you go.
Okay, so right now, I want you to focus muna tayo, no? Talagang ating alalahanin kung ano ba ang importance of our dental health. Di ba nga sabi sa ating Biblia, we are to follow what the excellence of God is, na cleanliness, and even how can we share God's love in our smiles if we do not have healthy teeth. So of course, we have been blessed with the knowledge and the wisdom how to take care of our teeth. So before we start, um, ating balikan yung basic anatomy na ating ngipin. So you can see here sa screen nyo, ayan, that our teeth basically has parts. So meron tayong crown, meron din tayong root. So ito yung crown and then the root part. So ang nakikita natin when we open our mouth and when we brush our teeth is the crown only. And of course, meron din yung layers. So as you can see here, no? Teka, let's zoom in. Ayan. Let's zoom in. Here, you can see that you have parts. Sa outer covering ng ating ngipin, you have the enamel. Yan. Later on, maybe we will ask a few questions so you can take down notes and answer. I think merong reward whenever you can get the correct answer. So the outer part of our teeth is called enamel. And did you know that it's actually the hardest part of the body, even harder than the bone? Okay? That's the enamel. So, sa second layer ng crown natin, another layer is present. Itong parang flesh-colored. Yan. It's called the dentine. The dentine, usually, hindi siya ganun katigas as the enamel. So, anong ibig sabihin nito? Once na masira yung outer covering, pagdating dito sa second layer, biglang lalaki yung sira. So, this is the reason why mamaya makikita natin na minsan, maybe we will flash an example. Maliit lang siya kapag tiningnan sa bibig, pero once na inopen namin mga dentist, malaki na pala siya sa loob. This is the reason why. Kasi may layers pa lang ating ngipin. Outer layer, enamel, which is the hardest. And second layer is the dentine, which is lesser ang density niya compared sa enamel. So after the second layer, ito na yung parang pinaka-center ng ngipin natin, which is, anong nakalagay dito? It's called the pulp. Okay? So what does the pulp contain? Ano yung nasa loob nito? Ito yung mga nagloloob ng ating blood supply, kung saan dumadalo yung dugo ng ating ngipin, kung bakit tayo nakakaramdam ng coldness or hot or sensitivity, bakit nabubuhay yung ngipin natin because of the pulp. Dito nagmumula yung nerves and the blood supply ng ating ngipin. So of course, hindi lang tayo doon nagpo-focus. Syempre, ang buong bibig natin nakakonekta yan sa ating gums, sa ating buto, and of course, the whole body natin. Hindi lang siya tinitingnan as it is na mag-isa siya. So of course, you can see here, no? You have your bone, you have the gums, and ayan, the blood vessels as well. So kapag tayo ay nagkakaroon ng problems with the gums and the bone, hindi ibig sabihin na, nakakapag-toothbrush ako. Pero bakit kaya ganon? Biglang gumagalaw yung ngipin ko, bigla-bigla. Maybe, the reason why is, healthy baka yung ngipin, pero ang hindi naman healthy ay yung bone or yung gums na nakasurround sa ating ngipin. Why? Kasi, it's a interconnected part of our body. So, hindi lang yung mismong ngipin yung tinitingnan, pero kundi meron ding supporting na mga structures, which is the gums and the bone. So, yun yung simula ng ating discussion. And of course, ang main topic natin is our oral hygiene and our dental care. Ayan. So, meron lang akong parang quick trivia na alam niyo ba na sa ating bibig, after mo mag-brush, in 2 to 3 hours, meron na tayong na-form na plaque. So, ang plaque, it's actually soft food. And when you look at it sa microscope, it's actually bacteria, which is normal naman talaga nangyayari because we have our saliva, we have our microorganisms sa bibig natin, na normally nagpo-form talaga siya ng plaque. So, it's not harmful, but it's normal. The reason why we are to brush our teeth morning, after meals, and then evening before we sleep. So another trivia, if you floss, you can even increase your span ng ngipin mo to 6.4 years. And of course, meron ding mga ibang studies that it can delay the effect of aging. Do you believe that? It's actually minimal, but of course, the best way to delay aging is to follow Newstar. Alright? So meron lang mga studies that would say that. So, and then the next trivia is smoking leads to more than half of all cases of gum disease. So, nakakalungkot, no? Kasi actually sa Philippines, medyo prone talaga tayo to periodontal diseases or gum disease, right? Ito yung mga pagtanda is biglang naglulusan na lang yung ngipin. One major cause is smoking. Bakit kaya ganun, no? Well, a little bit of background sa smoking. When we smoke cigarette, it actually parang kino-constrict niya yung blood vessels all over the body mo, and most importantly sa bibig, and nawawalan siya ng blood supply. So ano nangyayari? Hindi nagkakaroon ng proper nutrition yung ating gums, yung bone, yung ngipin natin. So it will lead to more chances of gum disease. So ayun, if ever na meron talaga tayong mga family members or mga kakilala na nag-smoke, hindi lang pala yan lungs ang masisira, it can even lead to problems sa ating dental. Okay? So, ayan, balikan natin, no? Balik tayo sa anatomy ng tooth. So, nakita na natin, hardest part of the tooth is enamel. Anong part ng tooth ang nagko-contain ng nerves? It's the pulp. Okay? And then, ano yung nakasandwich between enamel and pulp? It's our dentine. Okay? So, ayan. Ang ating ngipin, it has different shapes, right? So, you have actually observed that. And this is the reason why mas kailangan ng care in other parts of our oral cavity. Have you noticed, di ba, na ang molars natin, it has many grooves. Marami siyang mga indent, para siyang grooves which leads to food to be trapped inside. So as you can see here, no, kapag front teeth, wala masyadong grooves, it's smooth surface. Pero when it comes to going backwards, you have the premolars, you have the molar, yung mga bagang. So, ang problem lang sa mga kids, hindi pala nila nare-reach ng maayos yung mga molars nila. Kasi ang usually nakikita nila is the front teeth, so yun lang yung focus nila when brushing. So here is the reason why as mothers or as parents, we are to correct and be patient in treating the habits of our children. So talagang hayaan natin sila to be trained how to properly brush. So later on, we will also tackle like ano ba talaga ang proper brushing. There's also a difference when a person has braces and also when wala namang braces. So what is the proper brushing technique? So what else can we, ayan. Have you heard the parang kataga na ay baby teeth lang naman yan, so okay lang kahit hindi yan maalagaan or kahit mabunot siya, di ba? So usually, ang mali natin as Filipinos, hinahayaan lang natin na masira yung baby teeth kasi we try to reason out na natatanggal lang din naman to. So here, I would like to strongly contradict that. Why? Kasi alam naman natin, di ba, as children, these are the years that we form habits. So, during these years, ito yung habits na matatake niya until adulthood. So, as parents, if you have nasanay na yung mga bata sa hindi masyadong okay ang oral hygiene, bata pa lang, so paano na kaya kung biglang nag-erupt na, tumubo na yung mga permanent teeth? So, biglang matututo? So, hindi, di ba? So we have to really be patient even at the start of even the baby teeth. Okay? So I want to show you itong ang primary teeth kasi ng mga baby, it's actually from usually 6 months of age until ano, until 10 months or until 2 years old, nag-erupt na yan. Okay? So, one trivia that I want to share right now sa mga bata, sa mga may nag-aalaga, alam niyo ba na the first dental visit, first dental visit ng mga kids is actually when the first tooth erupts. So, yun, it's in the 6 months of age or 6 months to 1 year of age. Yun yung time na dapat natin silang dinadala sa dental clinic. Right? So, ang hirap kasi 'di ba minsan pinapangtakot pa ng mga nanay ang pagpunta sa dentista, 'di ba? So gusto nating i-break yung ganong habit or ganong pag-iisip sa atin na uy, tatakutin natin na sige, baka mabunutan ka na doon. So dadalhin kita sa dentist, bunutan yan. So yung nagiging mindset ng mga kids when they come to the dental clinic is na-condition na pala yung mind nila to fear the dentist. So why? Kasi hindi pala sila nasabi na or na-prepare yung mind nila na okay, 6 months of age, we will go to visit your dentist because they want to take care of your teeth. So this is one example or one reason why we are to acquaint bakit natin gustong isanayin ang mga bata when they visit the dentist. You know, mahirap ito when we treat mga kids na may trauma na already, you know. Even adults have trauma kasi parang nadala sila sa dentist during the time na sobrang sakit na ng ngipin nila. So of course, as dentists, minimal na lang ang pain relief na pwede namin ibigay. So usually talaga, they will connect the painful experience to the dental visit. So we want to change that. Gusto nating ibigay yung experience na delightful, and we want to help them achieve their smile, their wonderful smile. So, ayan. When we come to our permanent teeth, 'di ba? Parang biglang dumami. Syempre, of course, madami yung permanent teeth natin, mapapalitan yung mga primary teeth. Hi, I want to show you one photo of why we are to take care of this child's teeth. So as you can see, no, sa screen natin, meron tayong mga baby teeth. Ayan, nakatubo yung mga baby teeth na itong batang nasa screen. And dito sa taas niya, ito yung actually picture of how the teeth develops. So habang nandyan pa yung mga baby teeth, nagde-develop na onti, little by little, yung mga permanent teeth natin sa taas. So, nasa taas sila. So, what is the purpose of our baby teeth? Meron ba yung role? So, yes, meron siyang role because it actually serves as a guide kung paano sila lalabas into the oral cavity sa bibig ng bata. So, anong mangyayari when mabilis na tanggal or mabilis na sira yung baby teeth, right? Ang nangyayari dito, nagkakaroon ng tendency na mas malposition ang mga permanent teeth kasi hindi na nila makita yung pathway kung saan sila tutubo. Right? So, isa pang reason is kapag maaga siyang natanggal, syempre, magkakaroon ng sungki-sungki. Kapag tumanda, mas prone ang sungki ng ngipin to other dental diseases like caries, like gum diseases, kasi mas mahirap siya i-brush. So, right, as parents, we are to really take care of this primary or baby teeth. Okay? So, now let's move on to the permanent teeth. Ayan, you have 32 teeth sa bibig natin. And let's move to reasons why we are to take care. Ano yung mga kailangan nating i-avoid sa mga baby teeth? Ayan, sa mga bata. Bata muna tayo, tapos saka tayo sa pagtanda later. Meron tayong tinatawag na types of caries. This can apply to babies or kids or adults. So meron tayong pit and fissure caries. So yung mga butas ng ngipin natin. Meron naman tayong smooth surface, yung kahit walang butas pero dahil madaming palaging acid yung bibig nila, kahit smooth yung surface, nagkaka-caries. So, meron din yung smooth surface caries. Meron din tayong tinatawag na cervical caries. Ito, katulad dito, yung malapit sa gums ng ngipin na nakikita. So, that's your cervical caries. And then, the nursing bottle caries. So, ano kaya yung nursing bottle caries? So, let's see muna, what is the reason bakit ba nagkakaroon ng tooth decay? Ano ba yung mechanism behind it? So, when we eat, when we eat, yung mga kinakain natin, it's composed of carbohydrates, di ba? Sugar, ayan. Anything that we eat, when it comes into our mouth, comes in contact with your tooth and the microorganisms in our bibig, di ba? And of course, you have your saliva. So, 4 components, right? As you can see here, meron tayong 4 components kung paano nagsisimula yung dental caries. Meron tayong ngipin, that's your susceptible tooth. Tapos, kumain tayo ng sugar or any food, kahit kakanin man yan, basta yung mga food that can trigger much more caries, yung mga sticky food, sweet food, ayan. When we eat that, and it comes in contact with your bacteria, which is normally present naman sa ating bibig, and ito pa, time. So what is the meaning of time? The more frequent that you eat in a day gives you a higher risk for caries. Most especially, di ba, kapag yung mga kinakain pa natin ay sticky food, sweet food, tapos highly acidic food. So, when we understand this, how are we to prevent naman? Ano kaya yung pwede nating ma-eliminate for us to somehow delay or even prevent dental caries? Kung naintindihan na natin to na, okay, kapag kumain ng any food, you have your sugar. And then you have your tooth. Natatanggal ba natin yung ngipin? Syempre, gusto natin, we are to preserve it. So, we cannot remove the tooth just to remove the caries, di ba? So, bacteria, can we remove it? Our mouth has really millions of bacteria. So, hindi talaga natin siya pwedeng ma-eliminate. So, how can we control caries formation? So, one is to control the type of food that we eat. Later on, nutrition, yan. Kasi the more that we eat yung mga sticky food, highly sweet, yung mga processed food, like, ang mga bata, ang gusto nilang pagkain is yung mga juice na kahit sabihin natin apple flavored, pero hindi naman talaga siya apple. So, the sugar in that drink, chucky, or anything that will parang substitute mo sa water, anything can contain additional sugar. So, buti sana kung it's really naturally sourced. So, when that comes in contact, the sugar, how can we avoid? Then, move to another alternative. So, try natin na piliin yung mga pagkain na mas may fiber, na less sticky, which is, di ba, ang fruits natin, it's like swipes lang yung mga tooth surfaces natin, hindi talaga siya nagsistick, di ba? So, another way is through time. Ayan, do you remember yung counsel sa ating health counsel na we are to eat, it's either best is like 3 times a day, or minsan mas better pa for some individuals ay 2 meals a day, and then yung iba ay pinopromote talaga is no in-between meals. You know one of the reason why? Because I think we are sure that God knows how our body functions. So there are studies already when they saw or tracked, tiningnan nila how the acidity of our mouth levels are when a person eats like 5 times or meron mga in-between meals. Tinrack nila yon. So what did they see? They can really see spike sa acidity ng ating saliva. So it means na that when we follow that counsel of eating 3 times a day or twice a day without in-between meals, we greatly lessen the susceptibility or yung parang probability na mas masira yung ngipin natin. But of course, when kids really need energy, try to switch. Ayan, slowly lang naman tayo. Ang gusto natin is we slowly switch. When we get to understand all this wisdom, let's switch them to more naturally sourced na snacks as children. Okay? So, ayan, medyo pumupunta na tayo sa practical aspect of our lecture. So, ayan, we understood na when bacteria comes into contact with the food that we eat, the type of food that we eat, kung mas sticky ba yan, mas prone to caries. So, it produces acid na tumutunaw doon sa outer surface ng ating ngipin. Yan. What else? Can you see here in the picture? Diba? When we talk about the enamel, the hardest part, kapag nasimulan na yang sirain ng acid and the bacteria, tuloy-tuloy na yan, and it reaches the second layer, ang mahirap pa dito, mga ka-health-wise, when it reaches the second layer, bigla yang lalapad. Why? Kasi 'di ba, mas malambot compared to the enamel yung second layer natin. So, sadly, kapag hindi pa ito naagapan, 'di ba, ang mga tao usually pumupunta lang sa dentist, kapag masakit na yung ngipin. So, that's really a wrong practice. Why? Kasi when the tooth starts to become sensitive, I want to give you a tip sa mga nanonood. When a tooth is sensitive for like 15 seconds or less than a minute, less than 2 minutes, ganyan, it's the natural sensitivity lang. But when a tooth is sensitive for 30 minutes to 1 hour to overnight, 30 minutes to 1 hour overnight, that's one sure sign na infected na yung loob ng ngipin. So, what does it mean to you who are watching? Then, dun papasok yung regular check-up kasi hindi pala siya nalalaman sa symptoms or yung kung sumakit na ba, tsaka lang pupunta. Hindi pala ganon because when the tooth tells your body na masakit na yung ngipin, it means that it is beyond yung regular na pasta lang. It means na kailangan na ng mas complicated na treatment. So, ayaw naman natin na aabot na sa ganon. So, we want to, most of the time, we want to educate and to prevent these things from happening. So, as you can see, sadly, ito sa picture na to, you can see na umabot na sa second layer. Ayan. Umabot na sa second layer and then umabot na siya sa pulp. So, we want to prevent that. So, when we come to the gums, ano naman yung ating i-observe? Ayan. When we talk about gums, there are two main symptoms na kailangan natin i-watch out. You see yung mga bleeding gums, yung sobrang bilis mag-bleed, that's actually probably a sign of gingivitis. Yan. It's the inflammation of gingival tissue or yung gums. So, you can see here at the picture, it's swollen. Tapos kapag nag-toothbrush, mabilis mag-bleed. So, yung iba, pinapabayaan lang to. And kapag napabayaan kasi yung gingivitis, it can actually proceed to something worse. Hindi lang sa gums. Umaabot na pala to sa bone. So, how will you treat that? So, yung iba, since mahirap na ang treatment ng periodontitis, it's a long sequence talaga since lilinisin lahat ng mga diseased na gums, aalisin lahat ng naipon na dumi. So, some would just opt na tanggalin na lang yung ngipin. So, that's sad kasi when you lose it, you can never have it back. False teeth will never replace yung enjoyment ng natural teeth. Right? So, as first na-observe nyo pa lang itong gingivitis na to, it's a sign na visit your dentist and check kung ano yung reason behind this. It may be caused by other diseases din kasi, like diabetics, they are more prone to gingivitis. So, ayan. You know na 70% of tooth loss ay actually caused by periodontal disease. Ito yung sad in that fact. Kasi, makikita mo yung ngipin, wala siyang sira, pero it's so loose na pwede na siyang matanggal with 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 just one stroke, because the bone surrounding the tooth has already detached. So sobrang na irritate sa ating mga tooth deposits, yung mga dumi sa ngipin. So it affects 3 out of 4 people. So ayan, pag-aralan natin what is the causes of periodontal diseases. So of course, main cause is hindi proper ang hygiene of the patient, the oral hygiene. Then one is broken fillings. Minsan kasi pag nasira yung mga pasta, it can actually cause more food to go into spaces, 'di ba? Mas hindi na siya smooth. So mas pumapasok yung mga food. So in response, yung gums natin, hindi nila kayang linisin yon. So nagre-recede na lang sila, bumababa na lang, pati yung bone bumababa. So that's the reason why regular check-up din talaga is truly important. Misaligned or crowded teeth. So 'di ba? We have remembered kanina when we encounter mga patients na crowded ang ngipin or sungki-sungki. So it's parang cause may lead to periodontal diseases kasi hindi nga proper ang ma-reach yung areas na dapat nare-reach if the teeth is properly aligned. Alright? So, meron din of course systemic diseases na nagkukos ng periodontal disease. Meron din namang cases na kapag pregnant ang women, di ba, they are more prone to gingivitis, which actually is caused by hormones lang naman. It goes away after the pregnancy. So, of course, there are some drugs din that can cause periodontal diseases. Pero, for the sake of time, we will just tackle the basics of our oral hygiene. So, how can you tell if you have periodontal diseases? Paano mo makikita? Meron, pagtingin mo sa salamin, it's red, hindi siya pinkish, hindi siya coral pink. You have tenderness, parang makate, parang pag pinapress mo, medyo iba yung feeling. Gums that bleed, of course, bad breath or halitosis. And when you touch your teeth, it moves. So, may severe cases din, and even sa diabetics, when they press the gums, merong pus or nana na lumalabas. So, we do not want this to be experienced by anyone. So, gusto natin na we are to prevent even leading to this. So, brush and oral hygiene is truly important. Ayan. When we tackle that, balik na tayo sa childhood. Ayan. If you have seen a child, 'di ba? Meron silang habit na thumb sucking, no? Yung parang yung sinisip-sip nila yung kanilang thumb. So it actually can cause this, ayan, nakita niyo na ba yung ganitong case na mas nagfo-forward yung front teeth kasi nga yung position of the thumb to the oral cavity pinupush niya yung front teeth. So imagine mo na every day that child does that habit, edi mas, nangyayari? Mas nafo-force forward and it would cause malocclusion. So mahirap to i-correct. So maraming ways how to correct this. Meron tayong i-flash later. Ayan yung mga bad habit of the children. And of course, meron din tayong mga cases na mouth breather yung baby, yung pag pinansin mo ay sa bibig sila humihinga. So, how do we correct that? Minsan, it's caused by malocclusion din. Hindi nila ma-properly close yung bibig. So, dito na pumapasok yung importance of braces. Yan. Hindi lang ang braces is for fashion. Yun yung mahirap ngayon, di ba? Akala nila is fashion ang braces. And some cases pa, hindi pala proper ang pag-brushing technique nila, and it would even cause, braces would even cause more harm than good. So gusto natin when we do something sa ating oral cavity, even braces, most importantly braces, you have to be able to check talaga with your dentist if you are qualified, if you have properly corrected your habits, kasi it may cause more harm than good nga. So let's move on. Ayan, thumb sucking, no? Ayan yung habit that we want to correct kapag babies. We have different ways to correct that, and para lang hindi matuloy-tuloy yung habit ng baby. So these are all done in the clinic, and kailangan na siya ng appointment because you do not want for your child to experience this until they grow up, right? Because as you have remembered, di ba, when the baby teeth is maloccluded, magiging sungki din yung permanent teeth. So gusto nating i-prevent yung ganon. Ayan. So when we talked about kanina yung caries, 'di ba, na intindihan na natin how it works. You have also listened kung paano nagkakaroon ng gingivitis, which is the bleeding gums. Kung paano siya lead to periodontitis or yung mas worse kapag hindi na cure yung gingivitis. We also have edentulism. Parang it's a scientific term para we can tell na naubos na yung ngipin or may nabunghin ng ngipin. Meron din tayong mga ulcers or mga singaw, and even oral cancer, which is rare, but you have to remember that is a possibility. That oral cancer really happens, especially kapag may mga patients na tobacco users, ayan. And of course, staining of teeth, which is easy naman to correct by the cleaning. Ayan. So of course, when we have to prevent our caries, we have to reduce sugar intake, right? Or when we pick wisely kung anong kakainin natin, when we choose vegetables, fruits, and natural snack for our kids, it can really prevent our caries. Of course, brushing twice a day, flossing once daily, and use of mouthwash, and healthy snacking habit. Okay? So let's move to how are we, ayan, let's look at this. Yan, gusto ko lang ipakita to sa lahat ng mga nagbe-braces. Okay. Ayan. Ito yung mahirap kasing ituro sa mga may braces, that hindi lang nagfo-focus sa ibabaw ng ngipin when you have braces. You should actually slip yung mga bristles ng brush mo below and even above the metal of your brace. Diba? When you do not have braces, madali lang kasi circular motions lang yung brushing. And of course, you have to reach until the last tooth. So as you can see, no, tingnan niyo yung angle. So to all who have children na nagbe-brace or have braces or planning to have braces. As you can see, hindi lang front, hindi lang siya ganyan mag-brush. Pero the picture shows na top and bottom part of the braces is to be cleaned as well. So take the time to properly brush braces or yung orthodontic appliance natin. Okay, so prevention of gingivitis, ayan, proper oral hygiene, yung brushing natin, regular cleaning, right, every 6 months, and of course, kung may bad habit ka, mouth smoking or mouth breathing, kailangan i-correct yon. And ayan, proper brushing technique. So, how about if you have seen yourself na, uy, meron pala akong periodontitis. As you have listened to this lecture, meron pala akong signs na meron akong periodontitis. How can we help as dentists? You can schedule your appointment with your dentist, and yon, magkakaroon na tayo ng scaling, which is removal of hard deposits or yung hard na bacteria which has formed this parang siyang stony surface on your teeth kasi matagal na siya masyadong naiipon. So we will perform scaling. Ayan. And of course, after scaling, hindi naman pwede na you will just go back to your old habits. So you will need to maintain and even correct your oral hygiene habits. And sometimes, kapag worse na talaga ang mga cases, kailangan pang mag-flap or sometimes i-remove namin yung diseased or dead part of the gums. So even sometimes kailangan pang magdagdag ng bone kasi sobra na siyang na loosen. So these are complex procedures already which we want, if possible, to avoid na to come to this treatment plan. Prevention is always better. Okay? So how about when you have lost a teeth? Kailangan ko bang ma-replace? Well, yes, because I want to show you a picture. Maybe you have actually seen this or experienced na when a teeth has extract, ayan, nabunot, has been extracted, it has a chance na ang surrounding teeth would drift. Ano ibig sabihin nito? It would go into the area where the empty slot is. Ayan. As you can see, no? Let's zoom in. You can see itong ngipin na to, medyo pahiga na siya. And ito naman, bumababa siya. So, what does it mean for you? Here on the areas na mas bandang likod or are surrounding the tooth that move into the space, it can even cause spaces. So kapag may spaces, may tendency for food to go into that area. Mahirap ulit i-brush. Tapos may cases pa na sa sobrang tagal na hindi nablagyan ng pustiso, nababite pa niya yung opposite na gums. So the reason why we should really have an application or a denture or a fixed denture to fill in the empty spaces kapag tayo ay nagkaroon ng bunot. So, when we talk about these things, ayan, you have different types, di ba? Meron tayong complete denture, yung pag wala ng ngipin, meron tayong parang partial lang kasi meron pang natitira. And then, of course, with the implants, which some people really prefer kasi it's like a tooth that goes into the bone. Of course, this is painless kasi it's under anesthesia. So, it's actually parang replacing the teeth as well. So, you have many options. You can consult your dentist for this, which is the best treatment plan for you. So, cancer of the oral cavity. We know now we are living in a world na parang, we cannot really prevent, but we are to be informed. If ever cases like this are present, kailangan nating makita what are the first signs. Because when we talk about cancer ng oral cavity or even any parts of the body, early detection can really play a huge role sa good na outcome or battle with it. So, what are the signs and symptoms of cancer? Usually, when there is an unhealing, hindi nag-heal na mouth ulcer, 2 weeks na, 3 weeks na, pabalik-balik, it's just there. Or maybe 6 months na, lumalaki, di ba? So, this is actually a sign of cancer. If there is a white or red patch that doesn't go away, so you have to really check. And even your dentist, we usually do the routine check of your oral cavity for these ulcers or red patches or white patches. Or parang hindi ka makalunok. Ayan. It's a sign na you have to also consult other doctors. Sometimes we do refer to ENT doctors, right? So difficulty in chewing or swallowing. So sometimes ang patients na may cancer, bigla silang namamayat because they have difficulty in moving their tongue if the oral cancer is on their tongue. So numbness and poorly fitting denture due to swelling, biglang may namamaga na 6 months ang maga and it doesn't go away. Pain, ayan, in the ear. So these are things na parang without the cause but it actually happens. So of course, with this, you have to consult your dentist. Ayan. So when we come to proper oral hygiene, ayan, let's tackle na, ayan, with proper oral hygiene, we can really achieve lifetime quality of life, 'di ba? Hindi naman ibig sabihin na pag tumanda ako, natural talaga na mabubunot yung ngipin. No, it's actually you can really preserve your teeth even until you are old, 'di ba? And of course, before we go and we end, ang gusto ko lang din i-share, there are actually cases for patients that needs surgery. So this is actually my field, oral surgery. So if you know patient na may impacted teeth, so ito yung actually panoramic x-ray. Ayan. This is usually what I do in my clinic. Ayan. Okay. So, sorry about that. So you can see here na meron silang impacted teeth na nakahiga. So this is a reason why we are doing surgery. So nakita niyo yung red arrows? These red arrows are showing na nagkakaroon na ng caries in between the impacted teeth na nakahiga and the second molar. So yes, in that case, ang nangyayari, nabubunot na rin minsan yung second molar. So, isn't it sad? Because if ever na na-prevent naman, natanggal siya ng maaga, di ba? Hindi naman needed na talagang masira din tong second molar. But because of neglect, di ba? Mas pinabayaan, akala okay lang. So, hinayaan pa na pag sumakit na lang, Dok, tsaka na lang ako mapatanggal. So, all these cases will lead to a more aggressive or parang mas worse na outcome. So, if you had a chance to do this x-ray and discovered na meron kang impacted teeth, you can also contact your dentist and schedule your appointment kung kailangan ba siya for removal. So of course, meron ding kaming tinitingnan if it is really needed for removal or it's actually better to leave it stayed as it is kung hindi naman siya nakaka-harm ng ngipin na katabi. Alright? So as we now go to the last part of our lecture, ayan. So of course, teeth brushing technique, very basic na to, no? It's really, sometimes we overlook kasi nga, ay, toothbrush, I think I know it. So what is the proper way to brushing? So at least 2 minutes, pero of course, hindi naman pwede na 2 minutes, pero mali naman yung technique. So we want to use short, gentle strokes. So short, gentle strokes na circular motions. Bakit? Diba usually ginagawa natin ganyan. It has a tendency to harm this part of your teeth. Pakita ko sa inyo, no? Can you see this part, this neck part? Ayan. When you brush na horizontal, na talagang long, hard strokes, ganyan. This part of your tooth is actually thinner, mas manipis siya. So, nangyayari, na-injure yung area na to and mas na gagasgas siya, that would lead to caries, hindi siya caries a cavity that would trigger sensitivity. Mas nagkukos ng sensitive, diba? Okay, so that's the reason why we are to use short, gentle strokes. And then, may angle siya, 45 degrees, hindi lang siya ganyan. Of course, you angulate it para mapupunta din yung bristles to the gum port, para malilinis din niya yung gums na area. So, of course, clean the outer surface of upper teeth, then lower teeth, and the chewing surface. So, lastly, brush your tongue. And how often should you replace your toothbrush? So every 3 months, di ba? Usually, we really want na bago ang brush natin, toothbrush natin. And the toothpaste, marami namang brand ng toothpaste, but it can actually differ kung sensitive ka. You can use a toothpaste that is for sensitive teeth. So, but all of it generally works naman. Okay? So, when should you visit a dentist? Of course, every 6 months, and especially if you have highly sensitive teeth, kapag parang feeling mo bigla na lang sumasakit, and even bleeding gums, which is everyday na lang nagbe-bleed, bad breath, and loosening of teeth. So, every 6 months, we are to recommend na we have to get an appointment with our dentist. So, let us, be encouraged to regularly visit your dentist, for with this, we can, I just want to show you. When we visit our dentist, we prevent this from happening, right? Yung mga areas ng ngipin natin na merong grooves, and then, pinatagal pa natin, hindi natin pinapasta, akala natin maliit pa lang naman yung black, tapos nagkabutas na, umabot na siya sa center ng ngipin. So as you can see, sobrang laki na niya sa loob, and ang liit lang ng butas sa taas. So we want to prevent this from happening, and all of this can be prevented. Yun ang magandang news for all of us, right? So with the knowledge that we have received this morning, we are to act on it. So gusto natin na we are to guide the little ones, Ate Ian and Kuya Ian and Ate Jen. We are to guide the little ones, correct the habits of the adult, and to teach other people as well. So yun.
Thank you so much, Doc Alexa. Grabe, ang daming learnings.
Daming natutunan.
Nako, may question tayo.
Actually, we have only one question. Kasi we have,
In the
kasi
interest of
konti na
time.
lang yung time natin. Doc, can you prepare 5 questions? Kasi we have 6 actually questions. Yung sa amin na yung last question. No? So 5, may madali, medyo merong mahirap, and we will give gifts and more prizes
Yes.
today.
Yeah.
Ayan.
So ang question natin for today is isa
From
lang
Korea.
naman. From Korea.
Sabi niya, si Sister Cecil, question po, Doc, my son had his 2 front teeth extraction dahil mabilis na lumalabas yung permanent teeth niya sa upper front. Nung nag-apply ng anesthesia, nag-swell siya. Sabi ng doktor, babalik sa normal yung gums until 6 months. Lagpas na po 6 months pero ganun pa din siya. Bakit po kaya ganun na nangyari? And ano po dapat gawin? Ayan.
Actually, if ever na 6 months, it's not caused by the anesthesia anymore. Kasi when we talk about acute kasi di ba? When we talk about acute, it happens at a really short time. So when we talk about anesthesia, nagsasubside yan kasi the blood flow takes it away from the local area, right? So even if mahirap kasi mag-advise through online, so in cases na like this, merong kaming mga diagnosis that blocked na salivary glands, kaya may swelling, kulay blue yon. So it's actually a different case. Probably it may be caused by nagsabay lang yung happening, pero hindi talaga siya caused by the anesthesia. Because anesthesia would regularly be flushed out by our blood. Immediately lang, like in 3 hours, it can be completely gone already. So if it is like 6 months already and may swelling, it can be caused by either trauma, yung parang laging na tatamaan ng food, so na-irritate yung gums, or hindi nakikilin ng maayos, or something na meron din tinatawag na granuloma, which is swelling naman ng gums talaga. Kailangan na yung putulin. So all these things are different treatment plans na that is best to be discussed. Kasi tinitingnan pa namin kung ano ba yung laman ng swelling, right? It can be sometimes just filled by saliva na naipon dun sa beneath the mucosa or the gums of the patient. Or minsan sa lips pa nga. Minsan sa lips na may namamaga. So, yun po, it's better to go back
Go back to the dentist.
And check.
I see.
Tsaka actually, talking about the teeth, dahil nabanggit ko nga kanina yung mga kabataan ay dito sa Philippines, especially mga Filipino children, ay madalas nga na nagsisira yung ngipin kasi napapansin natin na hinahayaan kasi natin mga magulang na kumain ng mga candies and mga sweets. Ewan ko ba bakit mahilig. ang mga candies and mga bata sa candies, no? Yun po ay iiwasan natin. Mas maganda kung mahilig sa sweets, mga fruits na lang, no? At saka,
Oo.
Doc, I think, pagkakain talagang kailangan mag-toothbrush ka agad. Di ba?
Oo. Tsaka
Para
water.
water, di ba?
Yeah.
Oo, wag nating hayaan na mamaya pa tayo
Yes,
mag-toothbrush.
kasi I actually, intake of water is actually neglected. Parang hindi siya masyadong na-connect usually sa dental health. Pero when a patient really drinks water na talagang frequent, we can really observe na hindi talaga sila na lalagyan nagkakaroon ng dental caries. Kasi the flushing effect of water can really help balance yung rush out any sweet or substances. So kasi kapag dry ang mouth, may prone talaga siya to caries kapag wala masyadong saliva and fluid in the oral cavity. So turuan natin yung mga children natin kasi a habit yun no? Talagang papainumin natin sila ng tubig.
Naku, Doc, may mga, medyo bilisan natin ng konti kasi meron pa mga questions pahabol. So, kay Glenn Sebastian, when is the best time for the first toothbrush of babies? Kailan daw?
Actually, kapag tumubo na yung first teeth, which is primary tooth, 6 months of age, usually nandiyan na yan, ang baby.
Okay. So, yan. Next question. Doc, Alexa, kailangan po kaya ipa-surgery yung impacted tooth na isa ng anak ko kasi yung isa pinairis ko dahil masakit pa nga. Oo. So, galing kay Heidi na Nelmida.
Ayan, so 'di ba usually umaabot kasi sa time na pag sumakit doon na lang pinapatanggal. Much better if i-repeat yung panoramic x-ray and then nakikita kasi namin as dentist if it would really lead to pain. So when the dentist sees the x-ray and open siya sa bibig, nakita namin na may possibility to go ang food dun sa area, we really remove it even if hindi pa talaga siya sumasakit. Kasi mas mahirap kapag nasira pa yung katabing ngipin. So, yun po.
Galing kay Sister Shalom. Hello, sis.
Ayan, last question na to.
How many times dapat mag-toothbrush? Sabi, 2 times daw ang advice, pero you mentioned 2 to 3 hours later, may plaque na ulit, di ba?
Yes, oo. Actually, plaque is soft deposits lang yan. It's a good thing to really note na hindi naman talaga totally clean ang bibig natin. Pero, of course, tama talaga na after meals, kasi naiipon na yung plaque, which is naturally occurring, plus the food pa, so tapal-tapal na. That's the reason why we are to brush after meals. But another thing that I want to tell na, if you can brush 45 minutes after meals. So, bakit may 45 minutes? Paano hindi agad after meals? Kasi, if you remember na, when we eat, di ba, tataas yung acid ng bibig natin. When we immediately brush, so, we know na hindi siya ganun ka strong at that moment, may differences siya. Kasi, less ang protection or acid kasi, mataas yung acid. Kapag binrush natin, may chance to aggravate yung mga soft area of the teeth, which is thinner areas of enamel. Pag binrush mo yon, tapos aggressive brusher ka pa, may chance to have parang class 5 cavity. Yung it talks about the neck. Yung neck ng ngipin, mas nagko-cause ng sensitivity doon. So if you can, 45 minutes after meals. Okay.
So yung last question, pahabol pa, no? Doc, paano yung, I think nabanggit yung kanina to yung thumb sucking, paano maiwasan? So meron kayo diniscuss kanina, di ba? So, very quick lang, Doc, para proceed na tayo sa question and answer.
Ayan. Actually may appliance. So, ini-impressionan yung bata, tapos nagkakaroon kami ng permanent na kinakabit namin para may metal, hindi na nila ipe-press. Okay? So, sometimes nagalagay din yung iba ng tape sa thumb, palagi. So, it's a habit na kinokorek. So, ang pinaka-effective talaga is to put the permanent appliance para hindi comforting kasi yun sa kids. So, it really has to have a permanent appliance na medyo natutusok. Hindi naman really natutusok, pero uncomfortable na for them. So, they will really correct the habit. So, yun.
You put down the appliance. Like yung ref or TV.
Hindi mali pala. Anong baklaseng appliance? Mali naman.
So yes, Sister Leonie, bali 3 times a day or every time you eat, you brush your teeth. Yun. Diba? Okay, Doc, prepare na kayo ng question and answer kasi ano muna kami ng picker wheel kung anong price. Actually, sa picker wheel, dinagdag namin ang may load pa rin kaming dinagdag na 200 and 100. O, di ba?
Para exciting. Okay. Ano muna ang price natin for this first question? Again, please, for those who will win the prize, basta't hindi load, give us your complete name, complete address with barangay, and mobile number. Pero sa mga load, kahit mobile number lang.
Load or Gcash.
Load or Gcash. So this is chili garlic. What is the first question, Doc Alexa?
Ayan. Sa parts ng ngipin natin, what is the hardest part of our tooth?
Oh, what is the hardest part of our tooth?
Ayan.
What is the hardest part of our tooth?
Ayan.
Hardest.
So, sige, sagot-sagot na po. At I think we need to greet some of our viewers.
So habang sumasagot po kayo, sagot lang po. Pero
Gusto kong
mag-greet lang po tayo.
Yes, gusto kong batiin. Ayan. Marami na kasi ulit mga bago. Okay? Habang sumasagot kayo, we have
So
only
habang
few
hinahanap
seconds.
mo, uulitin ko dapat pala naka-like and follow kayo sa aming Facebook page, sa Healthwise for Christ, and dapat naka-subscribe din kayo sa aming YouTube channel na
YouTube
Healthwise.
channel, nabubulol ang aking
Yun.
asawa.
Ba't ba ako nabubuyoy? Anyway,
Okay, so Anita Alo, hello.
hi,
And
from Rojas City.
Mark Lawrence Baroga.
And
Ayan,
from
hello.
Binangonan, Rizal.
Lani Taladro from Antique.
Wow.
Binangonan Rizal pa si
Si
Milagros.
Milagros, ayan. And Lani is from Antique.
Okay, tingnan natin yung mga sagot.
Ano pala ang sagot?
Ano pala ang sagot?
Ayan.
Okay. The hardest part of the tooth is the enamel.
Wow!
Enamel.
Ang daming sumagot, Doc.
And the winner and the first winner is one of our YouTubers, Teresa Begonia. Winner po kayo ng chili garlic.
Teresa?
Ayan. Teresa Begonia. Ayan.
Ayan.
And for the next 3 na makakakuha ng consolation prize na 50 pesos GCash or load is Gracia Tumaneng. Ayan.
Gracia Tumaneng, yes.
And then the next one is Ariel Von Guting. Ayan. And Shirley Ruga. Kaso lang, Doc, kakonsider ba natin to enamek? Medyo baka
Type error lang. Okay lang yun.
baka na typo error lang. Ayan. Enamel po. Baka
Okay.
K lang ang napindot. Hindi, magkatabi naman yung K and L, so justifiable. Si Shirley Ruga, yan. Panalo po kayo.
Ayan.
Ayan.
Shirley
Ruga.
Ruga. Ayan.
Okay, what is next from our picker wheel? Okay, so yan. At i-spin muna natin.
Ayan. I'd like to announce pala lahat ng fathers na nakikinig ngayon. I-send nyo lang po inyong picture na kayo ay father. Will give additional 50 pesos.
Ayun.
Additional 50 pesos. Pamaya.
Additional.
Peanut butter.
Peanut butter.
butter.
Napakasarap yan, mga ka-healthwise. Ayan. O ulit, yung in-announce ni Ate Jen. Wait, yung question muna. Doc.
Okay. It's tuwing kailan, every how many months should you visit the dentist?
How many? Madali lang yun, di ba?
Oo. How many, what's the question again? How many
Yeah,
months?
How many months
How many
do you need to visit a dentist?
How many
Ayan.
months? Okay. So, again, habang nagsasagot po kayo, in-announce po ito ni Ate Jen ha, yung inyo pong mga fathers, lahat po ng mga fathers.
Mga fathers. Lahat po
Mali.
ng mga fathers.
Lahat ng mga fathers.
May additional 50 pesos kayo. I-send nyo lang po yung picture nyo kasama yung family nyo
Just
or
for
anak
just
or
for today.
asawa. Ayan.
Just for today, we will
Ay, anak
accept.
pala.
We will accept all the entries just for today.
Mm-mm.
Okay, just for today. Pero bukas, di na po natin tatanggapin. So, send us a picture of your family.
Just for today lang po, ano?
For all the fathers who are listening right now, yung po mga nakikinig. Ayan.
Additional 50 pesos
Ayan.
Gcash or load.
Yes.
Shirley Luruga, yes. Kung di mo pa nakuha yung load mo, i-message mo lang kami at yung
Yeah.
date para ma-check po namin yung record. Okay?
Alright.
Anong sagot? Doc, Alexa.
Every 6 months.
6 months.
6 months. And the
Ayan.
first winner is Rocky Lukban. Panalo. Panalo ng peanut butter. Sister Rocky, message nyo lang ang Healthwise for Christ. Ayan. Send your complete name, address, everything. Ayan.
And 50
Next,
pesos.
for the 50 pesos load, Ludinet Casro.
Casio.
Sorry. Rosita Ramos. Ayan. And Nash Spinner. Ayan.
Wow.
Maraming salamat sa inyong
Rosita Ramos.
Yeah,
and
if you're coming from different or outside of the Philippines, nominate the number of your loved one in the Philippines na pwede nating pasahan ng GCash or 50 pesos na load.
Ayan.
Alright.
Okay. So,
Our next question is...
teka, picker wheel muna tayo.
Oo nga pala.
O, inuulit ko lahat ng fathers na nakikinig ngayon. Send your picture with your children or ano.
And then of course, send na nila yung cellphone.
Cellphone natin. Oh,
Herbs and Spices book. Wow.
okay.
Paganda ng book na to.
Okay,
Ayan.
anong question? Ayan.
Ayan. Easy question lang tayo. Kailangan natin siyang sagutin na yes or no question.
Okay.
So, I want to ask, important bang alagaan ang baby teeth?
Oh, important bang alagaan ang baby teeth? Ayan. Sige, habang kayo ay
Yes
sumasagot.
or no? Habang sumasagot po
I'd
kayo.
like to greet, ayan, some of our viewers yan, si Rachel Fiolog, ayan, ako, mga regular viewer natin ito. Sino ba? Ang dami nang sumasagot. Anyway, sobrang
Oh, yung
natabunan
mga-
na yung ating mga
Yes, mga greetings.
greeter.
Anyway, yung pong mga, again, please, we remind you to, don't forget, mga fathers natin, send us a picture of your, and send us your mobile number. Yan. So, anong sagot, Doc?
Yes, di ba?
Yes,
Yes.
is the answer. So, ang first winner natin is, for herbs and spices,
Mhm. We
Nako.
give chance to others, Sister Rocky.
Sister Rocky,
Ang
give
bilis
chance.
nila.
Ang bilis mo talaga. Grabe, Sister Rocky. But we will give chance to others. Si Rosita Ramos, I think, already won the
Sa
50 pesos. Jing
Sky,
Sky.
yes.
Jing
for
Sky
Herbs
is
and
a winner
Spices.
of the Herbs and Spices book. So just send us your complete address and all that.
Then
The next three, top three, 50 pesos load is Christy Austria. Congratulations. Jade Boy. Congratulations. And humabol naman dyan. Si
Jade
Tita
Boy.
Melda Tumaning. From
Yes.
Bintar, Ilocos Norte.
Ah.
Ayan. Ayan, maraming salamat. So, let's go on to the next question. Ayan.
okay.
So, ano kayang price muna? Alamin natin.
Take note, may load din dyan or Gcash, Okay. Oh, 100 Gcash or load. Ayan.
Yun. Now, okay.
Okay.
Ano pong question?
Ayan. So, medyo tayo. Punta tayo sa what do you call the gum disease na nagkakaroon ng bleeding and swelling?
Mm.
So, anong tawag natin?
Yung bang pinakahuli nun may itis?
Meron.
Okay,
Alright.
so, ayan.
Ayan. So, ay mga sumasagot. Naku, daming sumasagot. Pero again paalala lang po ulit yung mga fathers natin. Please, just for today, just for Father's Day special. Okay,
100 Gcash to,
Ayan.
ang price natin. Okay.
Okay. Ano ang sagot, Doc?
Ayan. Gingivitis.
Wow,
Gingivitis. Naku, Tita Melda, nanalo kayo kaso lang. Bigyan natin ng chance yung iba.
Si
Ang winner
Glenn.
natin is Glenn Sebastian.
100.
Congratulations, YouTuber natin. 100 pesos load.
And the 50 pesos.
And the 50 pesos, Jeneline Bautista,
Jeneline
Marisa Salvacion,
Bautista. Okay.
and si JV Quaresma. Ayan, maraming salamat
Anong-
po.
Marisa.
Salvacion.
Okay.
Ayan. And CION. And then JV Quaresma.
Okay.
Alright.
Wow, congratulations. Dami nating pamimigay.
Yes. Okay. Next. Ano na ang nasa picker wheel natin? Dalawa na lang ito. Ayan.
Dalawa na lang. I think last question kay Doc and then sa atin yung
Oo.
Oh, 200 Gcash. Ayan. Sino kaya ang
Okay.
mapalad?
Sino ang mapalad na to na makaka-receive
Or load.
ng 200 Gcash?
Or load.
Doc, ano ang tanong?
Okay. So, medyo hirapan natin, no?
Kasi 200 yan.
Okay. Merong four things that can affect caries formation. Una is the tooth. Second is the time. Third is the, the food. Ano yung last na hindi ko nabanggit? The tooth itself, the time, and the food. Ano yung hindi ko nabanggit?
Medyo mahirap na yun.
Medyo mahirap na.
Hindi ko alam kung may
Clue. Lagi siyang nasa bibig natin.
Lagi siyang nasa bibig natin.
Nako, lagi nasa bibig natin.
Meron
Iba
tayo.
ang mga sagot, pero may mga
Iba-iba ang
sumasagot.
sagot.
May mga malalakas ang loob na sumagot.
Kung ano doon nasa bibig natin.
O lahat
Okay.
na ng mga
Siyempre, hindi na pwede ang ngipin kasi nabanggit na. Meron ng
Oo.
tooth, meron ng time, meron ng food. So, ano po yung kailangang factor na kaya siya nagkakaroon talaga ng dental cavity?
Oh.
Yun.
Ayan, nagkakaroon ng dental cavity. Nako, ayan. Okay.
Okay.
Ay, teka, meron na ba tayong pang price? Ay, tama. Gcash, no?
Gcash na
So,
200.
ano ang tamang sagot? Dahil marami na pong sumagot, Doc Alexa.
Ayan. So, it's either microorganism or bacteria.
Aba, ang daming
dami
nakakuha
ng tamang sagot. Alright, so, sadali lang. Lalagyan natin dun sa pinakamataas.
Hindi lang po kasi to Facebook, may YouTube tayo. So, nasa amin po yung
Ayun.
record.
Uy, ang panalo is Kikendex Valiente.
Wow!
Congratulations! 200 Gcash or load. Ayan.
Kikendex
Siya yung ating
Valiente.
winner. And for the 50 pesos load, the top 3 is Lara Vera Ricamara.
Lara
Ayan.
Vera.
Si Ludinet Casio nakakuha na, no? Oh yes, nakakuha na siya. So, si
Lara Vera.
Angela Agbayani, ay hindi, smoking po ito. Sorry, hindi po ito pwede. Ayun, si Rachel Famero Feolog. Ayan. Rachel Feolog. Ayan.
Okay.
Ay wait, yung Lara Vera, sorry. I'm so sorry. Yung si Lara Vera Ricamara, wrong po yung sagot niya. So, I'm sorry, we have to
We have to check,
sorry po,
mahal.
pina-excite po natin. Sorry. Ako pong hindi nagbasa. Anyway po, ang next is si Rachel Feolog and si Jeneline Andal. Nanalo na ba?
Hindi pa.
Ayun, si Jeneline Andal. Sorry, Sister Lara Vera Ricamara, wrong po yung sagot niyo.
You have
Pero,
still chat.
yeah. Ito na ano to, typo na naman to. Bacteria daw talaga. Pero yung E, katabi naman ng R, so considered na po ito.
And then the last 50 pesos, kanina.
Last
Sagot
50
na bacteria.
pesos. Ay, sugar to eh. Ayun, Marisa Salvacion, nanalo na.
Marisa Salvacion. Meron na si Marisa Salvacion.
And then si... ito talagang tanggapin na ba natin?
Si Lara Bacteria. Yes, that's
Yes.
correct.
Okay. Talagang panalo siya. Panalo talaga siya. Amongst the order, kasi ito kinukuha po natin sa order ng pagpasok. So, kung sinong unang pumasok, dito po sa system namin, siya po ang makakakuha. So, Sister Lara, talagang deserve nyo talaga itong 50 pesos na to. Ayan. Tama naman ang sagot.
Okay, last question, I think,
Okay.
is
The
from
last
us.
question, of course, ang last question natin ay veggie coffee ang
Wag na natin
so wag na natin yung
I think the verse.
the verse.
They have to give the verse that relates to the topic.
Ano ang verse natin for
Wala
our
tayong binigay na
topic
verse, di ba?
today?
But they will give
the
verse for
oo.
relates to skeletal system.
Sino po ang pwedeng makabigay ng verse na relevant sa
Mga buto-buto.
buto-buto or sa topic natin ngayon? Ayan. Okay.
Ay, ang gagaling naman. Di ba?
Okay.
Gagaling naman. So, veggie coffee ang una and then another 50 pesos load.
Yeah. All right. So, ayan, ang dami na nagbigay ng verse. Pero anyway, okay, ang sabi dito, okay, merong unahin natin si Kikendex. Naku, nanalo na si Kikendex, right?
Pero we can read, no? Yung kanya.
Okay, let's just read na lang yung sa kanya.
First
Corinthians 10:31.
31?
Yep,
Yes.
31.
Okay. Sabi, therefore, whether you eat or drink or whatever you do all to the glory of God. Amen. No?
Amen.
But we, dahil nanalo ko ng Kendex, we'll give chance to others, ano?
Mm.
Let's
Si Teresa Begonia,
Psalms 34,
verse 5.
actually, yung mga first 10 greeters, may chance kayo ulit manalo doon sa mga prizes.
Mhm.
Ano? Pero pag nakakuha na kayo doon ng prize, I think we have to give to others.
Yes.
Okay.
Yung
Sino-
Teresa Begonia, hindi pa, wala
Wala
pa.
pa.
Ayun,
Ayan.
possible ito. Teresa Begonia, Psalms 34:5.
Ang
Anong
sabi
sabi?
sa Psalms 34, verse 5, ang sabi dito ay, they looked to him and were radiant, and their faces were not ashamed. Tama ba? Psalms 34,
Verse 5, yes. I see.
and their faces were not ashamed. Okay.
So,
Pero-
oo nga
pero-
naman, their faces are not ashamed kasi yung ngipin, when you smile,
Pwede, di ba?
di ba? Yan ba yun, Doc? Tama ba?
Oo,
Yeah, yun pala yun. So, panalo po kayo, Teresa Begonia.
Napaka-slow natin.
Oo nga. Kumain ka na ba? Hindi pa yata tayo kumain.
Teresa Begonia, you
Okay.
will receive veggie coffee.
Veggie coffee. Thank you so much. And for the others, pareho rin si
Sa 50 pesos load.
yung Haidina Garcia. Del Nido.
Yeah, lahat ng nagbigay ng verse, whether naulit or hindi, it's okay. So, sino yung next?
Ludinet Casio.
Meron na.
Meron na.
And then, we have
Okay.
also,
Yung, who else? Marisa Salvacion.
meron na rin.
Meron na. Mary Grace
Ay,
Tumaneng.
Marisa Salvacion.
Yeah, there you go.
Oh, yeah.
Okay, how about Mary Grace Tumaneng?
Mary Grace Tumaneng, wala pa.
Ayun, so siya yung panalo po natin ng 50 pesos load.
Mary
Grace Tumaneng. And then si Haidina nanalo na ba?
Haidina.
Ayan, nanalo siya ng ito. Yes. Psalms 34:5. Ayan.
Ayan.
And then last is
Haidina Salvacion, no?
last, Nelmida. Haidina Garcia.
Sorry.
Yan, Nelmida. Okay, so last
Babaliktad
is
na.
Angela Agbayani. 1 Corinthians 10:31. Whatever ye eat and drink, do it all for the glory of God.
Yeah.
Maraming salamat po sa lahat po ng mga nag-participate sa umagang ito ng Sunday. Happy Father's Day again to our fathers. Please, lahat ng fathers natin, send us your picture. Lahat lang po ng mga nakinig today, ha? And that's only just for today.
Message
ng live,
us
okay?
sa ating inbox.
Lahat po ng mga nakinig ng live.
Ayan.
So if you could get a screenshot of this live event here,
Mm-mm.
get a screenshot of this just to prove that you have watched it live. And then at the same time, send us a picture. Ayan.
Next week, abangan natin ang cooking demo. Dahil next week, ang prices na ipamimigay natin ay puro load and Gcash.
Yun.
Ayan, di ba, Doc? Na-excite din kayo, Doc, sa mga prices?
Pwede bang sumali dyan?
Pwede.
Okay.
Alright. So marami na naman tayong natutunan ngayong umaga. At
Maraming salamat po sa pagsama po ninyo muli sa amin ngayong umaga. So please don't forget to like our page and subscribe to our YouTube channel.
At hanggang sa muli po, ako po ulit si Kuya Ian na nagpapaalala sa inyong brush your teeth.
Brush your teeth.
Di pa talaga tayo kumain. Brush your teeth 3 times a day.
At ako naman po si Ate Jen, nagpapaalala na be healthy, be wise, health-wise. And
Doc,
Doc, any
paalala?
paalala and message?
Yes. So reminder lang na if you have chance, prevention is better than cure.
Yeah.
Ayan, thank you po muli. So next Sunday, cooking demo.
Bye-bye.
Isang makabuluhang talakayan patungkol sa ating kalusugan, kaligtasan at kagandahan. Kay Ate Doc lang yan. Mga tamang kaalaman at napapanahong usapin para sa pamilyang Pilipino. Siyempre, si Ate Doc yan. Kaya mga ka-wellness, andito na si Ate Doc, Cheryl Palad, upang bigyan tayo ng tamang kaalaman sa ating kalusugan, kaligtasan at kagandahan. Samahan si Ate Doc tuwing Biyernes, 1 p.m. Philippine Time. Dito lang yan sa V81 Radio Worldwide.